Thank you for joining me today. My name is Jessee. Of course, I know you, but for all of those tuning in, I'm Jessee. I'm a managing director at Sellers Dorsey. I have the privilege of being joined by Cindy Jordan, who's the CEO of PICS Health. This month is Mental Health Awareness Month, although we know that mental health is an important part of our system and something that we think about every day. But just to address the Mental Health Awareness Month goals, the goals are to raise awareness about mental health, to fight the stigma associated with mental health, provide support, educate the public, and advocate for policies that support people with mental illness and their families. Cindy, I'd like to ask that you share a little bit about you and your relationship with the topic of mental health.
Okay. Well, thanks for having me, Gary. It's good to be here with you. So yes, I do have a very personal connection to the mental health crisis, as I like to think of it. This is actually my second healthcare IT startup company, and actually, I had another one, and I sold it, and I really didn't think I would probably do another. But in 2017, my stepdaughter had a really terrible year. She was diagnosed with bipolar, and she was in and out of the emergency room quite a bit. And because she was an adult, we didn't even know this was happening. And then at the end of the year, she ended up in an inpatient facility, and there was addiction riddled in there, et cetera. And so when we kind of sat down as a family and said to her, "Hey, what are we missing? Like, what happened? What comes first before the wheels go off the bus?" She said that, she feels overwhelmingly lonely. And so I started doing a ton of research on loneliness and how it is intricately tied to behavioral health, and mental health, and realized that, PICS actually solves for loneliness as a part of the mental health spectrum because it is the tip of the spear. And a lot of times before we get into mental health crisis, loneliness comes first. And so my stepdaughter, Riley, she ended up passing away from her mental health struggles. And it's kind of even made what we're doing here at PICS, and for me personally, like very, very connected to this issue. At the top of, the opening remarks, you talked about stigma, you talked about raising awareness. There's something to be said about talking about losing one of your children to a mental health, disease. And the last text she ever sent anyone in the world, she said that she was lonely. And so, there's a lot of stigma for me as a parent associated with even talking about this kind of thing. So I am to say really personally connected would be an understatement. I really do believe that this is the next major health crisis facing our country, our world, really. And then I just chose, because of my personal journey, to focus exclusively on loneliness and isolation. But as we talk, you'll see that it's intricately connected into all of the major health, sort of conditions that we can think about, like depression and bipolar, anxiety, the list goes on.
Well, I'm happy to really visit with you because I have had the privilege of working with you, and I've seen the passion and I've seen the results. And I think so many of us who work in the industry of health and human services, we are called to action by our personal experiences. And so I want to thank you for being so honest and sharing personal information with those that are tuning in, because I think your experience absolutely can make a difference in the lives of families and individuals who are struggling with mental health challenges today. I know you know this, but I have the privilege of leading the national consulting practice at Sellers Dorsey. We work with states, managed care organizations, providers, and solution partners, including PICS, who are working tirelessly to meet the needs of individuals within the Medicaid system, including those with mental health needs. And before coming to Sellers Dorsey, I worked in state government for several decades, and I had the responsibility during my tenure to lead all of the health and human service programs. And mental health has always been an important area for me. I have also, like you, Cindy, have seen firsthand the struggles that individuals and their families face. and the need for quality services to meet their needs, to give them an opportunity to contribute and have meaningful lives. So as we get into our discussion, I want to share some statistics from the National Alliance on Mental Illness. I know none of these are going to come as a surprise to you, but I think it's helpful for people to really understand the prevalence and the importance of this work. But 21% of US adults experienced mental illness in 2020. That represents 52.9 million people and 1 in 5 adults. 5.6% of US adults experienced serious mental illness in 2020, and that's 14.2 million people, representing 1 in 20 adults. 16.5% of US youth aged 6 to 17 experienced a mental health disorder in 2016, representing 7.7 million individuals. 6.7 of US adults experienced a co-occurring substance use disorder and mental illness in 2020, representing 17 million lives. We know, and definitely I've learned through my work with you, people with depression have a 40% higher risk of developing cardiovascular and metabolic diseases than the general population. And people with serious mental illnesses are nearly twice as likely to develop these conditions. Just a few more statistics. 32.1% of US adults with mental illness also experienced a substance use disorder in 2020. At least 8.4 million people in the US provide care to an adult with mental or emotional health issues. And I think about you when I think of these statistics, Cindy. Caregivers of adults with mental or emotional health issues spend an average of 32 hours per week providing unpaid care. What should be really important to payers who are really paying attention to emergency room department usage. Mental illness and substance use disorders are involved in 1 out of every 8 emergency department visits by a US adult. And that's estimated to be 12 million visits. So I know these statistics are not surprising to you. We are seeing more than ever a focus on mental health. We know that the public health emergency highlighted the challenges of mental health, substance use disorders, depression, and loneliness. We've seen a deep commitment from CMS and states to really focus on better integration of physical and behavioral health and the ability to test new strategies to deliver care, because we know care should be focused, it should be customized, and be able to address individuals' needs where they are. We also talk more than ever about health equity. And health equity is much broader than just access to health care. But when we talk about health equity, we talk about access to care. We also talk about delivering supports around social determinants of health, housing and things like that make it possible for individuals to actually receive care. And so, Cindy, I want to ask you, after all of this time that you've spent both personally and professionally working in this area, are you encouraged about where things are moving as it relates to mental health supports?
I'm 100% encouraged. It's always easy to focus on what's not being done, and that would do a disservice to what's really going on in the mental health space right now. And the things that are most encouraging to me is, number one, one of the good byproducts of the pandemic, and I realize there are very few, but one of them is that we collectively as a society have a shared understanding now about mental health. Because if you yourself didn't feel it, somebody who did, and you likely were in a household with someone who did, right? So the shared understanding, what that does, it's because in the end, Gary, everything's human, right? We buy as humans first, not as CEOs or COOs or health plan executives. We buy as human beings. And now all of a sudden there's a real movement toward there is not a single call, and I really mean this, that I go on in the span of a week where somebody on the Zoom in one of those little squares doesn't say, hey, you know what, your story resonates with me because it's my story. And that's profound. The second thing I'm really encouraged about is that there's now money and innovation going toward this problem. So it's one thing to talk about it, it's another thing to understand it, And then finally, it's the most important thing to fund it. It's, I don't say this in a bad way, but you and I both know this, that healthcare follows the money. And if there's money to combat these actual real life problems, then, innovation will come next. And we need innovation because with all those stats you gave, the problem is so pervasive. If we just think that
Yes.
we're going to be able to put one care manager or one provider on every single person that needs, some kind of mental behavioral health attention, SDOH intervention, we're sadly mistaken. We have got to find some scale, and we've got to find a way to reach the pervasiveness of this problem.
I couldn't agree more. Um, I want to spend a little time really, and you talked about it, what we're seeing in terms of funding and innovations. And, it seems like just over really increasingly, but over the last several years, it feels like we've seen so much expansion of telehealth and technologies that can support individuals where they are.
Yep.
And so, as we think about what's next, like what we're seeing on the horizon, we're seeing lots of investments by government. We're seeing lots of reform related to Medicaid policies that are preventing barriers, trying to address issues. And one thing that I have learned, and I've learned this from working with you, is just the sheer innovation that's coming through technology, and
Yep.
recognizing that some of these technological solutions, while they are, incredibly complex behind in terms of code and other, they seem so simple, for use, and they're embraced by individuals who need the support and the outcomes, from payers. Payers are paying attention and recognizing that some of these innovations can lead to significant savings, and not by ratcheting down on care or
Right.
preventing access to care, but by providing care at the right time and in the right setting. And I think that, to me, is what is the best part of this business. And at this time, to get to say that, it's safe to say we have failed a lot of people who've come before individuals we have the privilege to serve today, because we just couldn't respond in a meaningful way. We didn't have the same use of technology, and we didn't have the same commitments that we're seeing. We focus on physical health, or we focus on behavioral health, but not the two together. So somebody was supported that had severe persistent mental illness, but their physical health was a wreck. And so
Yep.
now we've got these commitments and obligations to really focus. But because I know you're so much wiser in this area, what would you say, if asked, what more can be done to improve the systems of care, which we both have an opportunity to work in? And what advice would you give to states, providers, or payers who are listening in?
Yeah, I mean, I'll answer that question, but I first want to touch on something you said. The way that the industry is thinking about MH and PH comorbidities being treated together, which of course now just makes sense to everyone, um, is also the way that we should think about technology, right? I do not think that technology is a replacement for human intervention, but I do think that combined together, and this is a little shameless promotion, I mean, because that's what we do at PICS. We do have a technology component, but we also have a peer support model. And those two things together make it so that we can scale, so that we can get through health equity problems, so that we can reach people in rural and also urban areas, and we can cut across age and gender and all kinds of discrepancies. If you don't have tech, you're never, ever, ever really going to be able to clear the hurdle of health equity. Now that I said that, let's talk about like what I mean about that. So I do think that people like myself who start companies actually often ignore vulnerable populations, and particularly Medicaid and Medicare. And the reason that they do that is that it's a highly regulated space. Am I saying that CMS shouldn't be regulated? Absolutely not. It's there for a reason. It's on purpose. But we kind of get in our way, right? I chose to start Medicaid because that was Riley's journey. In fact, she was a Medi-Cal member out of California. She got incredible care there. But I also was looking around and saw that, most tech companies want to build for folks that have high speed internet and an Apple 17 or whatever the phone is now. They don't want to build for folks that are on a data plan using phones that are old. And so that's the number one thing that has to happen, is that we as innovators have to really look at where the problem lies and start to think about innovating for vulnerable populations. But when we do that, we need the help of our regulators. And so, we're in 50 plus markets right now in almost like 25 states. And I'll be honest, like not every state is easy to work with. Sometimes it takes months and months and months just to get what should be a fairly simple solution into the hands of the members. And those are the kind of things where I'm thinking, gosh, we have to make this easier, because then you'll attract more innovation. You'll attract more solutions, and you'll start to cut through health equity problems, right? And then finally, you know, you payers have to realize that, you said it perfectly, Gary, so I don't want to unsay it, but it's you can improve outcomes and save money without having to cut. If you spend on initiatives like mine and others, and there are many others out there, smart stuff, things, going after addiction, technology solutions geared toward youth. There's lots of things out there, but the payers have to lead the way and make it easy. Gosh, it's so hard sometimes to get into a contract with a payer. And then you clear that hurdle, and then you've got to clear the regulatory hurdle. And then 24 months later, the first member is actually getting the benefit of the solution. And so what I would say is that we all have a part to play in making it so that we can actually go after this problem, and not 5 years from now, but now.
Yeah, I think that it really resonates with me, having been a former administrator in a state. I understand the challenges, and I heard from providers regularly about the very laborious process of trying to become an enrolled Medicaid provider.
Yeah.
And now within systems of managed care, you get through that piece, and then you start the journey of working with a managed care company, working through their contracting process and their, agreements. I think the feedback is positive. I don't think there's anybody out there who is on the provider side or on the state side or a
Right.
payer side who would not disagree that sometimes our ability to bring innovations to individuals who desperately need them is really rests on how long it actually takes to just be able to be on par to say you're ready to go. And I will say, we know that magic can happen, because we saw during the public health emergency the relaxing
Yes.
of a lot of regulatory components that weren't designed to prevent or reduce any of the quality, but really was more on the administrative side of bringing these things and being able to test them. So, I do think there is a focus. We certainly see it in states and procurements around reducing provider abrasion, and we know that that's key, to the success of ensuring you have robust networks and that you have providers who provide high quality services, and that anybody. And I always say, whether you're in Medicaid or whether you know somebody in Medicaid, I always say to people, you're one catastrophic event, you're one diagnosis potentially from being in this system. And that is the reason why all of us have to work together to make this system of care the very best that it can be.
Yeah.
And so,
it's not
I agree with you
Medicaid
completely.
and Medicare anymore. It's like what we talked about. It's a shared understanding. We are all one event from actually, experiencing these kind of. Yeah, listen, the one thing I will say is that the people that choose to work in this industry are the best, most magnanimous, most dedicated people I've ever run across. And I mean that from payers to
I
regulators to
agree.
providers, et cetera. And that's maybe why it's so fulfilling. But how you said provider abrasion, we also have to mitigate innovator abrasion, right? Like, so those are the things I'm thinking of. Because in all these instances, all we're trying to do is do the right thing, along the entire spectrum. And so The good news about all of this, because I don't want to sound negative, because I don't feel negative about it. In fact, I feel
Yeah,
very positive about it. The good news is that there is there is a necessity, there is a need, and there is an urgency. And just like in the pandemic, all of those things will make it so that we are constantly iterating for improvement so that these members can be served.
I think that's great. I'll tell you that I learned a lot working with you, and one of the things that I learned is um, you never really know how a member is going to connect. You never know how a member is going to connect with a provider. You know, we
Right.
all have experiences with doctors and specialists, and sometimes you feel a close connection, sometimes you don't, and then we overlay these technological solutions like PICS, and some people it's hard to step back and go, now how is this going to work? And then you see the impact. I know from firsthand, the evidence, and not even evidence you've put together, but evidence that's been developed by
Yeah.
people who've used your solution that have really demonstrated what the utilization looks like for these types of technological supports and what the impact is on the use of. And so to me, having the opportunity to now work across the country with states and payers and providers, what's most inspiring is that there are innovators like you. And I think the only way that we continue to see this type of innovation and then the embrace and use of these innovations is just like you described, making it an environment where innovation is welcomed and innovation is supported long term. And sometimes you find, it didn't work exactly the way we wanted it, but you can always reform. It can't be the reason we don't try.
Right.
And so I'm very happy to get to spend some time with you, and Cindy, and sincerely that I feel like the ability to share your personal experience about Riley and what it's meant to you and your family, um, besides being devastating, I think the legacy that she's bringing, and really the benefits to so many people who will never know who she is, but will benefit from these types of supports that you've put in place, to me are the most inspiring. And so, I will say during Mental Health Awareness Month and every single day of the year, um, I would say I want to thank you for bringing a perspective and a personal feeling to this service need, and definitely from your entrepreneurial spirit of bringing innovations to the system. So,
Yeah. Thank you.
anything else you'd like to say before we end today?
No, no, just really appreciate the opportunity. This is such an important topic. And yeah, you said it perfectly. This is without a shadow of a doubt the most fulfilling work I've ever done, because every single day, we see the impact. And I know that Riley actually would be really proud. I was thinking about her while I was driving into work today, and I was just, you know, there there are many, many people that have been touched by PICS, all because of her. And I mean tens of thousands of people. And so, I was sort of offering her some gratitude while I drove here. Even though we miss her profoundly, you're right, her legacy does live on. And I am very proud of that work. So thank you for having me. Thank you for letting me share
Absolutely.
my story. And I'll look forward to catching up with you soon.
Absolutely. And thanks again for your commitment to this important area. And so we'll talk soon. Thank you
Okay.
so much.
Thanks, Gary.
Bye bye.
Bye.